Natural disasters are becoming increasingly more prevalent across the world, especially as climates continue to change. The number of natural disasters has increased fivefold over the last 50 years. Of these natural disasters, over 90% are water-related. These disasters include drought, wildfires, floods, and pollution. So what does this mean? Natural disasters affect health directly and indirectly. Recent studies have shown that besides the direct effects like injury, death, and stress, they also impact long-term cardiometabolic respiratory health and psychological health. There is also an increased burden on societies, people's livelihoods, economies, and healthcare systems, both on a community and a global level. So how can we help to minimize the effects of these natural disasters? We have used this framework from the United Nations Office for Disaster Risk Reduction as a jumping-off point for our call to action strategies.
First of all, this problem can be approached in a global level regarding international cooperation. As we stated before, different countries have been facing natural disasters they were not used to or in more extreme levels. On the other hand, many others have undergone them through several years and have adopted different strategies to face them in a better way. That is why our first proposal is aimed to improve social cohesion on a global scale, as different nations working together, aligned with Sustainable Development Goal 17 of the United Nations. We suggest to create an international conference organized by the WHO where the countries which have undergone these climate challenges for a longer time share their experiences and the strategies they have implemented, both preventive and reactive, to reduce the negative consequences of natural disasters. This will also help the countries to address Sendai Essentials 1, 2, and 9.
Social inequity is exacerbated by climate change's impact on the social determinants of health, non-medical factors that affect health. Employment is a crucial determinant and can be disrupted through damage to small businesses or migration of skilled workers. Loss of income creates financial pressure, leading to conflicts and strains social cohesion. A lack of social protection makes informal sector workers highly vulnerable to climate change due to the absence of regulations and financial aid. We propose that governments work with informal sectors to target financially excluded groups. This involves improving access to financial services, i.e. credit and insurance mechanisms, and also establishing social protection regulations, i.e. occupational health, sick pay, and annual leave. Lastly, we can seize climate disasters as opportunities for skills development and economic growth. Training programs on climate-smart practices and alternative income generation activities can diversify livelihoods and reduce vulnerability to climate-related risks.
Research shows that natural disaster frequencies and impacts are rising exponentially. The urban poor populate the highest risk areas, with rising numbers as urbanization and migration continue. The use of probabilistic damage modeling tools should be encouraged, like the freely available Climata, which correlates historical data with projected climate scenarios, enabling more resilient infrastructure planning. Historical data is not enough due to climate change's unpredictability, however, and collaboration with scientists to access scientific climate projections can be facilitated by funding interprofessional task forces. As society's most vulnerable are the most affected in a disaster, more inclusive cities with more accessible services should also be encouraged and funded, along with early warning systems and apps like Japan's KDIPS, which allows vulnerable people to provide medical information to be stored for use in disasters.
Following natural disasters, community resilience plays a large role in recovery. Resiliency is greatly dependent on social cohesion. Studies looking at community resiliency found that social cohesion and community resilience have a positive linear relationship. Increased social cohesion allows communities to have a greater capacity to adapt and facilitates collective problem solving within the community. Part of this problem solving includes hazard preparedness, and social cohesion allows self-organization and an effective response to hazards. Thus, we propose the WHO encourages community-based events and community involvement, such as volunteering, to increase social cohesion prior to natural disasters. Similarly, community leaders should be involved with decision-making surrounding the community in a grassroots approach to ensure the individualized needs of communities are met.
Finally, individual communities should be given resources to develop and maintain local coping strategies fitting into the social resilience point of the Sendai framework. Coping is an active process of the things people do to avoid being harmed by life strains. This is not a one-size-fits-all approach, as culture and community context will inform the appropriate strategies. To illustrate this idea, we take a case study of Indigenous communities in northern Alberta, Canada, who faced the Horse River wildfire in 2016. Distress from wildfire evacuations happened against the backdrop of historical traumas like the forced displacement of colonialism. Here, the strategy of storytelling in traditional sharing circles gave participants a chance to connect and cope.